And with us now is Dr. Charlene Wong, a pediatrician at Duke University. Dr. Wong, thanks for joining us today.
Thanks so much for having me.
So let's start first with your experience. How often are you seeing children who have coronavirus-related symptoms?
Yeah, it's been a steady pace since the beginning of the pandemic, with parents bringing their children in with symptoms that could be the coronavirus illness. Of course, the symptoms that the coronavirus presents with are very common among the many colds that kids get, year round. Certainly in the winter season, we have seen an uptick, as we usually do, though it's very interesting to see. It really shows that the masks and practicing our 3Ws is making a difference, because we're not seeing nearly as much flu and the other common colds we see in the winter.
And do we have any idea why young children are less likely to transmit this virus if they do get it?
Yeah, it's a great question. There are a lot of scientists who continue to study this. There are a couple of thoughts here. One is that when the virus comes into our bodies, it has to attach to a receptor in our respiratory or in our breathing tracts. And one hypothesis or idea is that kids have less of those receptors. And so that's one idea. A second is, I was just mentioning, kids get exposed to viruses all the time. And the family of coronaviruses is actually a very common one that causes our usual common colds when we're not in a pandemic. And so another thought is kids might have just been exposed to these other coronaviruses more recently, and so they're just less affected. And a final idea is that the way that kids' immune systems react to the virus that causes COVID-19 is just different than the way our adult bodies do, in a way that makes it a less severe illness for them.
And this idea that children are less likely to transmit the disease is one of the reasons why schools are reopening in some parts of our state. We had this reopen versus stay virtual debate last summer. We're having it here again. What's different this time around?
I think the biggest difference this time around is that back in March of last year, when all the schools were shutting down, we were trying to figure out if in the last academic year we could reopen. We had very little data. There was very little science to help inform that. We now have a lot of data and evidence from the United States, from the world, and even specifically here in North Carolina, that really demonstrates that it is safe to reopen schools, both for the students and the staff. And we know which of those prevention or mitigation measures that schools can put into place, like the masks, the social distancing, that really make it safe for both students and staff at schools to be in school.
And we're hearing a lot about these new variants across the state, across the country. How different do these variants affect children versus adults? Do we know?
In general, I would say we have more questions than we have answers about these variants. And I guess I'll start by saying we're not surprised to see these variants. This is what viruses and bacteria, this is what infections do. They change. They have these little changes that accumulate over time. I think certainly now that we're seeing some of these variants that spread more easily, that might be more severe if you get them, is concerning. I think that how these variants, and there are multiple of them that we're keeping our eye on, how they affect children is still something that is being studied. And again, there are multiple of them now. One that is commonly known as the UK variant, one that's the South Africa variant. We expect there will be more of them. And so it'll be really important we continue to keep track of those over time. I think right now the guidance is still very consistent in that the way to protect ourselves, our children, is to practice those 3Ws, wear a mask, wash your hands, wait at least 6 feet apart. And that protects you also against these variants.
And the question I'm sure many parents at home are wondering, how safe, or when is it going to be safe for my child to receive the vaccine?
Yeah, so the COVID-19 vaccines right now, of course, are rolling out across our state and the country. One of the vaccines, the Pfizer vaccine, can already be given to teenagers age 16 and up. There are trials that have recently completed enrollment for children aged 12 to 15. And so we expect some data on that in the coming months. Hopefully we see that those vaccines work to prevent this illness and also are very safe in our middle-aged children. It's still going to be some time, and there will be trials starting in younger children down to age 5. But it does take some months for those trials to find enough children to enroll, to have them go through the process and see what the results are. So I think it's possible some children will be able to be vaccinated before the next academic school year. And so much of it will really depend on what we see out of these clinical trials. But we certainly hope these vaccines have been shown to work very well in adults and be very safe. We hope that the same and hope and expect that the same will be true for children as well.
Dr. Wong, thank you for your time and for your expertise on the topic.
Thank you.